Hello guys, welcome back to another video. So I've just hopped into the car because I've got to go get my second Lanreotide injection, so the treatment I'm getting for my neuroendocrine cancer. So I've just got to go to the hospital, and in fact it's the start of quite a busy week for me and hospital visits. So I've got that today. I've also got a phone appointment with the oncologist today, so just to catch up I think over the phone. Whether he'll tell me my surgery date, I'm not sure, but I do have a trip to the hospital tomorrow as well, where I'm meeting the surgeons, as well as having my surgery pre-assessment tomorrow. So hopefully I'll find out tomorrow when my surgery date is for certain. A lot of helpful comments from my last video said that from their experience, when they've had surgery pre-assessments, then it's usually 1 to 2 weeks later that you get the surgery. So hopefully that's coming up very soon. And then the day after, I actually go to hospital again to get my second COVID-19 vaccine. So yeah, 3 trips to the hospital this week. So yeah, it's taken over a little bit this week, but it's good to feel like things are moving forward and we're getting sort of step closer to getting things sorted out. Anyway, I better get going because time's getting on and parking is pretty terrible at the hospital. So yeah, let's get going. So I've given up on parking at the hospital. Just end up driving around for ages trying to find a spot and never get there. So I've parked at the local Tesco. Thank you, Tesco. Sorry if you're watching. But anyway, nearly at the hospital now. Let's get inside and get this done. There you go, that's all done. I was in and out within like 15 minutes, which is great. Relatively painless. Although I'm kind of hobbling back to the car a little bit. So the injection, I don't know if I've said, actually goes into your bottom. So you get a little booklet. I've got a little booklet that reminds you of which side the bottom it went in last time, and you kind of alternate each time. So the old right got the treatment today. And yeah, so heading back to the car just to wait for this phone call from my oncologist next. So it's the next day, I'm back in Tesco car park. Hopefully Mr. Tesco doesn't watch this and send me a ticket. But today is, yeah, my meeting with the surgeon, see how that goes, and then I've got a pre-op assessment as well. So yeah, just fingers crossed I get a date for my operation. That's what I'm really hoping for, although I have prepared myself for them to say we'll be in touch about a date, just so I'm not disappointed. But yeah, I'm actually feeling not too bad today after yesterday's injection. Bowels are a little bit off, but other than that, not feeling too bad. So I've had no abdominal pain or anything like I did last time. So hopefully, yeah, my body's kind of used to the drug, and I'm not going to get as bad a side effects this time. So it's looking good. I better get out and get on my way because Jenny's meeting me. She stayed at her work last night and she's come up by train. So we're gonna meet in a second outside. All right, let's see how this goes. There she is. So it is the next day. Sorry, I didn't do any more filming yesterday, but I just wanted a bit of time to digest what the surgeon told us. So basically we had some good news, and we also had some other news. I'm sort of refusing to call it bad news, but I'll get to that in a minute. But the good news is that I am penciled in for my operation on Friday. So this video should be going up on Saturday, so less than a week away now, which is great. As I say, I'm penciled in, so it is subject to change. I'm still waiting for the confirmation from them. So they're going to give me a phone call to say that it's definitely happening. And I was told if it doesn't happen on Friday, then it'll happen the week after anyway. So it's coming up nice and close, which is good. So I'm feeling really positive about that, and he seems confident that the removal of that primary tumour in my small intestine is definitely possible. So he's going to remove a portion of my small intestines. He doesn't know exactly how much of my small intestines yet, and he won't know that until he's opened me up or whatever. But he said it could be as little as 10 to 15 centimetres. And he's also going to remove the lymph node that sort of came up on the scan as having some cancer there, and he said he'll remove some other lymph nodes around the area as well. So that's great. So I've got to go in for a COVID test 3 days before, and as long as that's okay, I'll be admitted, and then it's going to be 3 to 4 days apparently in hospital during a time which I can't have any visitors, which is going to be a bit sad, but it is what it is, and it's a step closer to where we want to eventually be with this whole situation. So now moving on to the other news, and it's a little bit of a curveball, I suppose. All along I've known that there's the chance that they could operate and open me up and find that the disease has spread further than the scans are suggesting. But the surgeon said he was going to actually have a look at my liver during this first operation, because 50% of people can have, and I can't remember the exact medical term, but basically micro disease, which is a disease spread throughout the whole liver that's not visible on scans. So I was a little bit shocked to hear that it was as high as 50%. So he's going to have a look at that during my first operation, and if there is micro disease, then unfortunately then liver resection is kind of going to be pointless, and it's going to be a case of managing and containing that disease in my liver for the rest of my life. So I'll be getting treatment for the rest of my life, which is a situation a lot of people with this kind of cancer do have to face. So I definitely wouldn't be alone with that, but I would love to wake up from my first operation and be told that the liver looks not too bad and there was no sign of any micro disease. So there was also another step involved now, or has been added, it seems, to getting that liver resection. So as long as he comes back and says there's no evidence of this micro disease, he would like to stabilize and try and reduce the disease before actually resecting the liver. The reason being, or one of the big reasons being, is that one of my tumours is kind of wrapped around the back of the liver and is very close to a major blood vessel, and he would feel a bit more confident if they could try and shrink the disease a little bit first and then resect my liver. And if you watch my last video, I went into kind of the disease in my liver, and I wasn't quite sure whether it would mean removing half my liver or just cutting out the actual tumours. He did say that it would be a full kind of removal of one side of my liver, basically. But yeah, so he wants to reduce the disease if he can, and the way he wants to do that is through a procedure called PRRT, which I've known about, and is a very good and successful treatment option for people with neuroendocrine tumours. It doesn't cure the disease, but it can cause shrinkage of the tumours, and it's basically a targeted radiotherapy. So it targets the diseased cells of neuroendocrine cancer. So that's what he mentioned yesterday in our meeting, that he would like to do that first, and then eventually with the intention to eventually moving on to resecting the liver. So anyway, it's never going to be straightforward. There was always going to be things that would crop up, and there's still hope that I can eventually get rid of all this cancer. So I'm just going to concentrate, if I can, on my operation on Friday, get that done, and then we'll go from there. So yeah, that's my news. Anyway, not much else to add, I don't think. I don't know whether I'll be able to make a video for next weekend if I'm in my operation on Friday, and then I'll be in hospital for a few days. So if you don't hear from me, I'll see you the other side of my first operation. And as always, if you did like the video, hit the like button and consider subscribing if you don't already. Appreciate all your support, and I'll catch you very soon. Bye.